Hello, I am Bruna from Tamus family, and we are here to continue our series of videos about explanation on fertility process. Today we are here with Dr. Nisha, our very special guest.
Hello, Bruna.
Hi. And she will answer today a few questions sent by real patients about women's fertility. Okay, so let's start from the basic. Actually, the first question is kind of a curiosity, and it's very interesting actually. Is it true that a woman has the total amount of eggs in her body since the early age of her life?
Yes, Bruna, this is in fact true. Every female is born with certain number of eggs, somewhere around 400,000. This is the number of eggs she is going to have whole her life. Out of these eggs, a few number of eggs are released every month when she starts puberty. Before that, these are in a sleeping stage. They are not active. But once the hormones start playing, there is a connection, from the brain, the signal comes for the eggs to start produce, and the body releases a few number of eggs, around 10 to 12 every month. Out of these 10 to 12 eggs, the best one, grows into a normal egg. It ovulates and it results in pregnancy. If it happens, fertilization, the rest just die down. That's why we say that the age is very important.
So when exactly a woman starts to release the eggs? From very early puberty, or is it late, a little bit late?
No, it is a little bit later. So see, what happens is the brain starts sending signal to the body that now you are ready to produce eggs. So the first few cycles are anovulatory, means there is no ovulation happening in these cycles. Only once the system sets in, the period cycle starts, and after, say, in some female 3 to 4 months, in some female 6 to 7 months, the ovulation pattern sets in, and then only she starts releasing the eggs.
I see. That's very interesting, which brings me to another question, which is, what is the fertility preservation process?
So, as I already told you, like there is a certain number of eggs, and out of that only there is a very few number. The eggs actually die down on their own. Only very few eggs remain fertile as you age. So, at somewhere around 16 to 24 years of age, when the puberty starts, the female is supposed to be the most fertile. They are at the peak of their fertility. At this point of time, what we mean is that each egg is capable of producing a baby.
Okay.
However, as you age, as you grow older, the mitochondria, which are the energy producing units in the egg, they somehow start dysfunctioning. So at somewhere around 38 to 40 years of age, for having a live baby, you need around 8 to 10 eggs.
Oh, wow.
Okay. So if you want to preserve your fertility, what you can do is that you can freeze your eggs at a little earlier, somewhere around in your late 20s or your early 30s, when the fertility potential of the eggs is very high, the number is very good, because you know that as you age, it is going to come down.
And how is this process of preservation is done? Because if a woman is between, let's say, 20 to 35 or a little bit late, how can she do it? Who should she talk to, and how is the process done?
So the best thing is, first of all, you have to do an assessment that where you stand. Okay. So once this assessment depends upon multiple factors: your age, your genetic history, your antral follicle count, your AMH. There are some blood tests which you need to do. So we put together all these factors. Once we put together all these factors, we can actually tell you that where you stand, what is your fertility potential. You may be, already late, or you may be already in very good time, that you have to just do it now, this is the right time, or maybe you are too early, you still have some time. So first you need to do is assess where you stand, what is your score, where you stand. Once you have that, then you can go for fertility preservation.
And they do it by doing tests, I mean.
Yeah, by doing tests, by meeting your doctor, the doctor takes your history, the doctor takes your genetic and family history, then the doctor does some tests, along with that the doctor does a ultrasound. So after that we can tell you that where you stand. Once it is decided that okay, fine, this is the right time, you have to do it now. First, let me tell you, Bruna, what is the aim? So we see that nowadays females are more career oriented.
Yes.
They don't want to have a baby right now, and that is exactly true also.
Yes.
Because having a baby puts you on a stop mode for at least some time.
For sure.
Okay.
Yes, yes.
So now as you are aging, you are advancing in your career, you are doing many things, but you don't want to put that stop right now. So if you freeze your eggs, say at 25, 26 years of age, even if you are 35, you are ready to carry the baby now, the age of your egg would be still 25, 26. It will not be 35.
That's
Okay?
amazing.
That's
actually
the
give powers
aim.
to women take care of their career or whatever they want to do before become a mom.
Exactly, exactly. In the process of preservation of fertility, what we do is we need to see the female on the second day of the period. From the second day of her menses, of her bleeding starts, we do some blood tests, we do a scan, and then we give some sort of injections.
Yes.
Okay. These are very mild injections. These are not very high doses. We just, depending upon your age, your BMI, this dose is calculated.
Yes.
So this injection is given for a period of around 10 to 12 days.
Okay.
Okay.
Does she has to come to the clinic every day?
No need. These are very simple. Most of the females are able to inject themselves.
Oh, okay.
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 So you don't need to come to the clinic. We may call you for some assessment, like we give you some dose. After 5 to 6 days, we call you back to do the scan. The purpose is to see whether the dose is sufficient for you or not. Okay. So these are simple injections. You need to take it on your tummy. The syringe is absolutely invisible.
Does
very
it hurt?
Thin. Honestly speaking,
Yeah.
it hurts as much as giving the blood sample.
Okay.
Not more than
okay.
that.
We can handle it.
It's like, you know, people take diabetic shots.
Yes.
Insulin.
Yes.
It's same.
Ah, it's the same needle.
Yeah, it's the same
okay.
needle.
Okay.
So you just take a simple shot. So that you take it from second day of period. You take it for 5 days as per the doctor's instruction. You come for a repeat scan. Then the doctor assesses whether the dose is sufficient for you, whether it needs to be increased or there needs to be some change in that. A repeat scan is needed after 3 to 4 days, and once we know that okay, fine, you are responding better, you have good number of follicles, and then we measure their size. Once we see that the most of the follicles are around 17 to 18 millimeter, we give you a last shot which is called trigger shot.
Okay.
It is usually given in night, and 36 hours later we do the process of retrieval of eggs.
And about the procedure itself, does it hurt?
I see. Bruna is very worried about the pain part.
I am.
Okay.
I am.
So let me tell you one thing,
Yeah.
that we have done a lot of natural cycle. Natural cycle means that your body is producing that one egg and we're trying to collect that one only. Okay, and this is a OPD procedure. You just walk into the clinic, you go to the OPD and we collect that one egg and we send it off. Patient walk from the table. So there is no anesthesia needed.
Ah, okay.
The amount of pain, we actually did a research on that. The amount of pain during a egg retrieval procedure is exactly equivalent to the amount of pain for a blood sample, and even less for some patients.
That sounds good.
Yeah. So the only thing is that because we are going to collect multiple eggs, we don't want the patient to suddenly jump on the table or something because of the fear. Because the fear is there, you know what is going to happen.
Yes.
So we give you a small IV dose of a medication so that you sleep for a period of 8 to 10 minutes. You not more than that. Okay. No intubation is required. We just give you small anesthesia.
Okay, just a little rest.
Yeah.
It's
so
fine.
not painful. Not painful.
Okay, that's good to hear. Dr. Nisha, tell me, how many eggs are needed in order to do the preservation of fertilization? I mean, if I'm thinking about having one child in a few years, how many eggs do I need to have storage for me?
So Bruna, there are two things to it. First of all, you need to understand that each human being is different. So we don't know about the potential of these eggs because we are freezing them earlier. So for one girl, even one may be sufficient because it is of very good quality, and for some maybe even 10 are not sufficient. Okay.
Why is that?
But that is
exactly?
that is because each human being is different. No two fingerprints are the same. So genetics are different, and also we are going to mix it with the sperm to create an embryo.
Yeah.
So the sperm also plays a very important role.
Yeah, makes sense. Yes, of
This
course.
is one thing. Now the second thing is it is also age related. Okay, the quality is varying from person to person, but on a general level, it is related to age. So if you are younger, you have more eggs and the quality is better, so you need less for having a live baby. But on the other hand, if you are older, the quality of egg gets compromised, and then you need more eggs for having that one live baby. For example, you are in your early 30s or late 20s, the average number of eggs required is around 8 to 10.
Okay.
However, if you are in your late 30s and early 40s, it's already sometimes very late. So if you are in your late 30s, the number of egg required is more to have that one live baby, because the quality gets compromised. Okay, and then you need to do more than one cycle to have the optimum number of eggs. Also, again, if you are in your very late, you are in your early 40s or something, sometimes the option is doing your self eggs, if you have not frozen, is not there, and then you are forced to take a donor egg or something.
Oh, okay. So basically when you have a woman that she's in 40s or late 30s, it might be a scenario where you're going to tell her that she will need an egg donor.
Yes, again depends upon, because we know that in your early 40s there are more chances of having congenital malformation and defects in the baby, more problems which are genetics related. So it is always better to have the frozen earlier. That's what we are talking about.
Dr. Nisha, just another point on the risks. I just want if you could elaborate a little bit more if there is any risk for a woman when she's taking the hormones, because sometimes we are, I can talk about myself on this too, we are worried about taking hormones and they may imbalance our hormones in our own body, or even cancer in the future or something like that.
So the doses we are giving they are very, very less. Okay, they don't have long-time side effects. They don't have long-term risk like cancer or something. Various researches have shown that. Also, you need to remember that the half-life, whatever is happening in your body, there is a half-life for that. Half-life is the amount of time for which it's gonna stay in your body and then it disappears from your body. So the half-life of these hormones is very rapid. In 12 to 24 hours, they are washed off from your body. So they are given for a very short duration, around 10 to 12 days. We give very mild doses to have multiple eggs or something. But there might be certain females who are very worried about that or something. Even for them, there is a solution that we can do a natural cycle. Every cycle, or we give oral tablets. With this, they are not high doses hormones or anything. So instead of having many eggs, you will have 2 or 3 eggs only. But you need to remember that in that case you will need to do multiple cycles. So because you are getting less number of eggs per cycle, so you need to do more cycles to get the sufficient number. But Bruna, let me be very specific about this one point, because this is a major concern with most of the females. Mostly the amount of injections we are giving, they are very low dose, and they mostly they do not have any long-term side effects. Now we are into 40 years, 50 years of this treatment. So we know that those females who received treatment earlier, we know their life cycle, we know that what kind of response they had, and if they had some side effects or not.
That's amazing. Okay, Dr. Nisha, I want to go back to one of the questions that we just mentioned, but actually is we heard a lot from our patients. They are worried about it. So I'm gonna give you an example just to put it in a very simple way. But let's say I'm 32 now and I decide to do eggs retrieval, and let's say around 15 to 20 eggs are taken out from my body and they are kept frozen. And let's say when I reach to my 37 years old, I have a husband, and then we decide to have a baby naturally. Will I be able to do it? Or just because I took my eggs out in the past years, does it mean that I don't have eggs anymore, or I am less fertile to do it?
So that's a very interesting question, Bruna, because females are really worried about that, and I also hear so many times female asking me this question. So to answer this question, let's go back to the physiology. I already told you that every female is born with certain number of eggs, and that number is fixed, And the second thing is that once you start puberty, from that certain number, from that fixed number, a certain amount comes into our active form every month. Okay?
Okay.
To explain this better, for example, if you have 400 eggs, just an example.
All right.
So every month once you start, 10 to 12 eggs, for example, out of 400, 12 comes, 10 comes, 390 is left.
Okay.
So out of these 10 eggs, only one will become mature and will ovulate.
All right.
But the rest 9 die down.
Okay.
For example, 400, 10 goes 390, 10 goes 380, 10 goes 370.
Okay.
So the remaining amount is decreasing as it is every month. Okay. Even if you don't do anything, even if you don't stimulate, this is going to go away. Okay.
Oh, okay.
Instead of letting it go waste, we are actually preserving those.
Ah, all right.
Okay.
Okay.
So it's the other way around.
Oh, yes.
Okay. We are not wasting anything. We are not depleting anything. We are preserving those which are actually which are actually dying. Okay. So out of 10, only one becomes mature. However, if we do the stimulation, we are actually maturing all 10 of them, taking them out and preserving. So we are actually benefiting from egg freezing.
That's amazing.
You understand now?
Yes, yes, that's amazing. That's why it's called preservation fertility.
Yes,
now it makes sense.
Yes, because we are not wasting those.
Yes.
We are actually using them. As it is, if I don't use it, if suppose I have like 400 and I don't use it, all 400 are going to go at one point of time.
So doing it, you're actually taking the opportunity and taking them and
to
freezing
preventing them. Yes.
Amazing.
Instead of wasting them, we are preserving them. Simple.
Amazing. Amazing. Thank you very much, Dr.
Most
Nisha.
welcome. It was
a
pleasure.
Thank you.
Thank you.
Thank you
Bye.
very much. Thank you, everyone. See you soon.